Multivitamin with iron Integra is a dietary supplement that contains a combination of vitamins and iron. These supplements are formulated to provide essential nutrients that may be lacking in the diet. The specific vitamins and minerals included in multivitamin with iron may vary depending on the formulation. Indications: multivitamin with iron Integra is indicated for the prevention and treatment of vitamin and iron deficiencies, particularly in individuals with poor dietary intake, malabsorption syndromes, or increased nutritional requirements. It may be prescribed to support overall health and well-being, especially in cases of inadequate nutrient intake. How to use: multivitamin with iron Integra is typically taken orally with a full glass of water. It is usually recommended to take the supplement with food to enhance absorption and reduce the risk of gastrointestinal side effects. Swallow the tablets whole and do not crush or chew them unless specifically instructed to do so. The dosage of multivitamin with iron Integra varies depending on the specific formulation and the individual's age, nutritional status, and medical condition. Follow the dosage instructions provided on the product label or as directed by a healthcare provider. Do not exceed the recommended dosage unless instructed to do so by a healthcare professional. Contraindications: multivitamin with iron Integra is contraindicated in individuals with non-hypersensitivity or allergy to any of the ingredients in the formulation, hemochromatosis, or other iron overload disorders, certain medical conditions or medications that may interact with specific vitamins or minerals in the supplement. Special instructions: iron supplements may interfere with the absorption of certain medications such as antibiotics, thyroid hormones, and certain osteoporosis medications. Take multivitamin with iron Integra at least 2 hours apart from these medications, unless otherwise instructed by a healthcare provider. Iron supplements may cause gastrointestinal side effects such as constipation, nausea, or stomach upset. If these side effects occur, consult a healthcare provider for guidance on managing them. Pregnant and breastfeeding women may have increased nutritional requirements and may benefit from supplementation with multivitamin with iron Integra. However, consult with a healthcare provider before starting any new supplement regimen during pregnancy or lactation. Side effects: common side effects associated with multivitamin with iron may include gastrointestinal discomfort, nausea, vomiting, constipation, diarrhea, stomach upset, metallic taste in the mouth due to iron content, darkening of the stools due to iron content. Less common side effects may include allergic reactions or interactions with other medications or supplements.